Good afternoon and Assalamualaikum. I would like to thank each and every one of you for being here with us at this live session from MASA University Saujana Putra Campus. I am Nur Faiza binti Abdul Razak, lecturer at the Faculty of Health Sciences, MASA University, and I will be moderating today's session. Today's webinar entitled Occupational Safety and Health Management in IR 4.0 is proudly organized by the Faculty of Health Sciences, MASA University. Dear viewers, before we proceed further, I would like to give you a brief overview of the program offered by the Faculty of Health Sciences at MASA University. Okay, we have three departments at MASA University. The first one is School of Physiotherapy. The second one is the Department of Environmental Health. The third one, Department of Medical Imaging. We offer diploma, bachelor for full-time, bachelor for ODL, and master. You wondering why you should join health sciences? This is a few good reasons for you. The first one is low risk of job redundancy, automation. It has an opportunity to work in variety of settings. This is a career you can feel good about, lucrative remuneration, no boring work routine, and very high job demand because it's essential services. We have Master of Physiotherapy. There will be 1-year program for full-time and 2-year program for part-time. This is the entry requirement. This entry requirement, dear viewer, if you have further question about this, please leave a comment at the chat box and we will get back to you. For the bachelor program, we have full-time program and open distance learning. There will be a Bachelor of Physiotherapy, Bachelor of Environmental Health and Safety, and Bachelor of the Medical Imaging. This is the entry requirement. For diploma, we have the Diploma in Physiotherapy, Diploma in Environmental Health, and Diploma in Medical Imaging. This is the entry requirement. And once again, if you have any question about this entry requirement, please leave the comment at chat below. And last but not least, we have Diploma in Occupational Safety and Health, and this is 3 years program. This is the entry requirement for the Diploma in OHS. In MASA University, an infinite excellence is what MASA aspires to provide for each of its graduates. Why you need to choose the Faculty of Health Sciences at MASA? Because in here, we have interactive teaching and emphasis of hands-on clinical skill. Because we have face-to-face or also online platform, LMS. We have wide list of hospital, institution for clinical and industrial placement. All our program accredited by MQA and JPA with international recognition. At MASA, we have cross-teaching by expert. MASA have the most number of health discipline in the single institution among IPTS. We have various study mode, conventional, also the open distance learning. And last but not least, we have experienced and dedicated international pool of academic staff. Dear viewers, at MASA, we also have offer scholarship. This is the list of the all scholarship you can take advantage. The first one is Haji Abdullah Academic Excellence, Foundation Scholarship, Blue Ribbon Scholarship, School Teacher Scholarship, Family Scholarship, and the Single Parent Scholarship. Please leave a comment and we will glad to guide you for this for the scholarship further. Also, we have collaboration and affiliation with the various associations and the university. We have student mobility program. This is the picture of the student mobility program at Japan, at India, and at Indonesia. We welcome you to join us. Dear viewers, please contact us through MASA website or through our faculty Facebook page to know more about our program, or simply leave a comment and we will get back to you. Your question concerning this webinar session can be listed in the chat box. Let's welcome Ts Soffian to our webinar today. The evaluation of occupational safety and health management has always dovetailed development in the industry. The fourth industrial revolution will inevitable cause of paradigm shift in OHS management. The integration of computation, networking, and physical processes that characterize IR 4.0 would leave employer as well as policymaker no choice but to bring more automation and artificial intelligence into OHS management. Join us di webinar to learn more about OHS management consequences and challenge in line with IR 4.0. Hai, Assalamualaikum Encik Mohd Soffian.
Waalaikumsalam, Pak Izzah.
Okay. Alright. So I will introduce our speaker today. Encik Mohd Soffian graduated from the University Malaysia Sabah in the Bachelor of Food Science and Nutrition. He also holds an executive diploma in occupational safety and health. He is registered professional technologist with the Malaysia Board of Technologists (MBOT) and has been appointed as one of the professional assessor of the MBOT panel of assessor. Encik Mohd Soffian has area of expertise include occupational safety and health, emergency first aid and trauma management, emergency response, food hygiene and safety, halal management, effective coaching and leadership, ethical marketing and business management. Okay, Encik Mohd Soffian, so you can start now. The viewers is all yours.
Hi all. First of all, thank you very much to MAHSA University for the invitation for me to share my experience and knowledge in regards of safety, occupational safety and health management. Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon to every one of you that follow this webinar. Without further ado, let me share with you our topic today, entitled OHS Management in IR or Industrial Revolution 4.0. Okay. First of all, before we go further, let's divide this session into several sessions or elements. First, I would like to talk about what is OHS is all about first. Then after that, we'll go to IR 4.0. So we have heard many times that safety is everyone's responsibilities. We have been told so. Either this is true or not. I'm not sure whether you believe it, or it is not a practice. So when we said about occupational safety and health, we are talking about people's safety at workplace. So please ask yourself, either you really believe in this, that safety is everyone's responsibility, or in the in reality, the practicality is safety is been handled by one particular person, or it's been handled by the overall entity, or the overall company, or the overall organization itself. So this is something for us to ponder today. Now, let us talk about OHS. What is OHS? OHS basically is an acronym to Occupational Safety and Health. So basically, when we talk about OHS, let's have a look on this video. Okay, when we talk about OHS, do you believe that in this particular video that I have shared with you earlier, we encountered that there's a workplace with this kind of setting in any part of the world. You can see how is the in terms of safety, in terms of health, as well as in terms of the economic factors and everything that we are talking about OHS in the workplace at this particular workplace. So let's go back to the question that I asked earlier. When we talk about safety is everybody's responsibilities, what do you think about this video? What is your comment? Now let's go to the another video. Okay, now this second video, you can see obviously when safety is being jeopardized, when you fail to plan your safety, your job in safety manners, or you fail to provide safety measures in all your work-related activities, so it will cause harm to the people, especially to the workers that involved in that particular work. So when we talk about OHS, is actually it is an interdisciplinary activities concerned with the prevention of occupational risks inherent to each work activities. When we talk about OHS, the focus is to safeguard the safety, health, as well as welfare people at work. At the end of the day, the essence of the OHS is focusing to safeguard the people, the environment, asset, and as well as the reputation of the company. That is what we talk about. What is OHS is all about. So let's have a look. How is OHS? How is OHS perspective in Malaysian in Malaysia? Let's have a look in Malaysia perspective. Okay, first of all, for your information, when we talk about OHS, okay, there is an OHS policy, national OHS policy that has been approved by the cabinet and signed by the Prime Minister at that moment in January 15, 2019. So just for your information, this is part of Occupational Safety and Health Master Plan 2020 or OHS MP 2020, and it is been done as a proof that the government is concerned and committed to improve the quality of occupational safety and health in the country. And the aim of this national policy is to protect the workers' right to a safe, healthy, and conducive work environment. So that is about national OHS policy. Okay, so let's have a look. How is the milestone of OHS in Malaysia? So if we talk about OHS, occupational safety and health in Malaysia, it has been went through several eras. Okay, from before 1914, during the steam boiler safety era, until up to latest, which is the OHS era. Okay, we have two OHS master plan era, which is the first OHS is 2010 to 2015, and the next is 2016 and 2020. And the current, with the current era, the OHS era, okay, basically we can see that the launch of the national policy that shows the commitment of the government, as well as the enforcement agencies, especially the Department of Occupational Safety and Health, as well as the Ministry of Human Resource, towards the rights of every workers to have a safe, healthy, and a conducive work environment. Now, when we talk about OHS in Malaysia, like it or not, we have to refer to two legislation that has been approved or endorsed by the Parliament, which is the Act 139, the Factories and Machinery Act, as well as the Occupational Safety and Health Act 1994. So, for your information, these two acts is under the jurisdiction of Department of Occupational Safety and Health, under Ministry of Human Resource. So, when we talk about OHS, like it or not, we have to refer to these two masters regulations or legislations in order for us to ensure that every workplace in Malaysia is adhered to the requirement that has been lined by the law. Now, when we talk about safety or OHS, okay, we have to understand who are the person involved in this particular area. So we talk about the practitioners. Okay, so based on the DOSH requirement and department, so I have defined, or I have divided the group of OHS practitioners into several subdivisions, such as the OHS enforcement, OHS management, or OH, occupational health, industrial hygiene, and some of the technical safety that has been defined by the law, as well as defined by the Department of Occupational Safety and Health in terms of the competent person. So you can see that basically there is more than 20% or more than 20 subdivision of OHS practitioners. But for your information, it is a common, or is a norm, when we talk about safety, people will only refer to safety and health officer, which is the SHO. But without further argument, just for your information, there's more than 20 OHS practitioners is available in Malaysia. And based on that, for your information, currently there are about 67,154 total competent person that has been registered by DOSH. Okay, so you can see here, when we talk about, let's say, safety officer, okay, so there are about 4,783 persons or safety officer that has been registered in Malaysia as of January 2020. Now, why do we care for OHS? That is the questions. Okay, we talk about OHS. Everybody is talk about safety first or whatsoever that is being cultivated in the workplace. Okay, so why we do care about OHS? Okay, based on the reports by ILO, the International Labour Organization, in 2019, they are estimated about 2.78 million death occurs at work yearly. Okay, so it is simply means that about 7,500% of people are people die due to unsafe and unhealthy working conditions every day, where 6,500 are dying to work-related disease and 1,000 die from the occupational accidents. Okay, so based on this, for your information, it costs the total loss of illnesses, injuries, and death by 2.99 trillion USD yearly, and about 3 trillion US dollar every year. Okay, this is the global statistics. Let's focus on Malaysian perspective. So now, based on the same, based on the statistic, the same year in 2019, the statistic that has been published by DOSH, okay, we can see here that the total number of 40,000 of occupational accident occurred in 2019. Okay, so an average of 112 cases a day, and besides, we can see that there's about 9,860 occupational disease that has been reported in 2019. Okay. Now, let's have a look. Why we do care for OHS? Okay, based on a report or based on a survey that has been conducted, it mentioned that Malaysian workers is being categorized as unhealthy workers. Why? Because based on the research that has been conducted in 2019, among 230 organizations involved, about 17,595 workers. Okay, it shows that Malaysian workers, such as 84%, are involved with the musculoskeletal problems. Okay, 51% have depressions. Okay, 45% do have mental illness problems. Okay, 32% having chronic diseases, such as the heart disease, diabetic, the hypertension. Then we can see that 17% of them are fatigue at work. Okay, and furthermore, okay, and many more you can see here. Okay, so why do we care for OHS? It's because we want to ensure that the workforce of Malaysia not only safe at work, not only free from accident, free from the hazards that maybe exist at workplace, but we also want to ensure that the workforce of Malaysia are in good conditions, in healthy conditions. Okay. Now, let's have a look on the industrial regulations. When we talk about industrial regulations, okay, we have to admit that there are several industrial regulations, okay, that has been happened. That has been happened in the industry or in the world. Okay, so basically now there are 4 industrial regulations. Okay, four stages of industrial regulations that has been happened. We can see that the first industry regulations 1.0 in 1784. Then industry 2.0 in 1870, when they talk about mass production, assembly line, and electrical energy. Then in 1969, where the industrial revolution 3.0 happened, where the focus of industries are more towards automations, about computers and electronics. And then the recent years, we talk about industry 4.0 or IR 4.0. When we talk about IR 4.0, okay, basically the focus of IR 4.0 is about internet, such as the Internet of Things, IoT, about the big data, cloud computing, and we can say that it is about technologies advancements. Okay, so now IR 4.0, we have first of all, for your information, Malaysia through MITI, the Ministry of International Trades. Okay, so we have launched a national agenda or national policy in terms of IR 4.0 in 2018, called as Industry Forward. Okay, I just would like to quote something from the reference, that is the national policy, okay, that has been mentioned by the Prime Minister during that moment, where he said that likewise Industry 4.0 could address many issues concerning manufacturing with regard to hazardous environments, health and safety of human labor, efficiency in managing supply chains, reduction in wastages, savings in time with efficient management of delivery systems. Okay, so refer to this, when we talk about the impact of IR 4.0 in terms of occupational safety and health. Okay, so we can see that it has been defined by our Prime Minister that moment, that they have no doubt IR 4.0 may bring some challenges towards health and safety of the human labor. Okay, so let's have a look further. What is it regarding? Okay, so when we talk about IR 4.0 in terms of Malaysian perspective, okay, so they already defined some transformation drivers, which is by having this, the IR 4.0 that has been defined, that has been aligned by the government. Our Malaysian target for IR 4.0 is by the year of 2025. Okay, the industrial regulations has been completed in Malaysia with certain targets or with certain objectives that to be achieved, with certain KPI to be achieved by the country, by the government towards the involvement of the industry. So due to that, the government has defined certain transformation drivers. Okay, so we can see here that certain drivers that has been listed by the government, such as the global economic order. Okay, the involvement of the global economic sectors by all the countries, either from the developed countries or we call as major players of the world economy, such as the US, UK, Japan, and we can see the next is technology advancements, knowledge and skills, global supply chain, the competitiveness, regulations, customer behavior, and others. So these are the 8 transformation drivers for IR 4.0 that has been defined or listed by the government, according to a research by MIGHT, the MIC, okay, the Malaysian Technology Strategy Outlook. Okay, so based on this, I come up the challenges. Okay, I use the transformation drivers as part of the challenges of IR 4.0 in managing. I put it as some of the challenges in terms of OHS management during IR 4.0. So now, let's have a look. Number one, okay, what will be the challenge of OHS management in IR 4.0? First, I put there regulations. Okay, when we talk about regulations, okay, now as mentioned earlier, when we talk about safety and health, occupational safety and health, okay, we are referring to two major legislation, which is the Occupational Safety and Health Act as well as the Factory Machineries Act. So basically, most of the industry players or most of the safety practitioners sees that this law is being outdated. Why? It's because certain laws, especially in terms of the punitive action, such as the fines, the imprisonment, all those kind of things seems to be too low. Such as, in order for them, let's say when we talk about fatality case, yeah, either one fatality or multiple fatality at work site, okay, the punitive action or the fines that will be enforced to the employer will be 50,000 ringgit maximums or 2 years imprisonment. Okay, so basically it is too low according it is look like too low, the fines compared to the value of life of human beings. Okay, then when we talk about the law itself, when we talk about coverage, we understand that, let's say we talk about OSHA. OSHA only covers the 10 industries that has been mentioned in the law. So certain industries is not being covered. Okay, and when we talk about regulation as well, we see that still lack of enforcement. Okay, now let's have a look. When we talk about industrial regulations, okay, some of the challenges that might facing by us in the future is in fact, just for information, it's happening now. We can see that the work, what do you call it? The way of work has been changed totally. We can see when we encounter COVID, especially nowadays. Last time, when we talk about work from home, it is something like dream in a. We can say that it's a daydreaming. Okay, but now we can see the recent MCO 3.0. The number of workers that should work from home has been increased by the order of the government. So work from home is no more weird things, but it's a new norm, which is something which is we can say daydream previously, but now it's already exists. Okay. Now, when we talk about coverage, I just wonder how is the current regulations can enforce this kind of work type of activity, such as work from home, all this kind of new norms can be enforced using the existing regulations. Okay. Not only that, we can see that the changes of the workforce market, such as we can see when the MCO coming, okay, the way of work. Previously, okay, when we say about food delivery, okay, when we say about food delivery, so basically a company will set up their own company for the purpose of delivery purposes, or maybe food industries for the sake of delivery purposes. But when we have a look in the current situations, we see that there's another company with the modus operandi of p-hailing serve the industries with this kind of modus operandi. But most of the riders, it's not their direct employer, okay, direct employee. So how is this existing regulations is going to cover this kind of employees group? Okay. Now let's have a look the challenge number 2. Challenge number 2 is the knowledge and skills. Okay, knowledge and skills issues or this challenge. I can say that the challenge of knowledge and skills is not only to the industry players, but also as well as to the enforcement agency. When we talk about IR 4.0, we talk about Internet of Things, we talk about big data, all those kind of technology revolutions. Okay, how are we really prepared in terms of our knowledge? Okay, such as nowadays, this webinar itself is a proof, okay, that we need to enhance our knowledge and skills in terms of IR 4.0. And the last challenge here that I put here is the technology advancement. Okay, when we talk about technology advancement, again, I said, okay, it is not only to the industrial players, okay, because I believe that when the industry would really want to go for it, they would invest. But how about our industry? Or how about our enforcement agency? Are we ready for it? Do we have the capacity to oversee the industrial players' their way of work, all those type of things, in terms of implementation, in terms of the technology used? Are we ready for the our enforcement agency is already into it or not? Okay. Next, when we talk about technology advancement, it will require more money. Okay, so it will require more investment. So is our financial is ready or not? So all these things, if let's say I put it in OHS, let's say as an example, okay, when we talk about technology advancement, when we talk about knowledge and skills, okay, so we understand that the current or the traditional way of doing safety job at workplace, such as the safety audit, it will require any employee to perform the job, such as, let's say we talk about safety audit for high-rise building. Okay, so we will need the auditor, okay, to get themselves ready and do visual inspection, all those type of things by themselves. But when we talk about technology advancement, it can be done easily by, let's say, deploy the drone, or maybe when we engage the certain technologies like the IoT, all those type of things. Okay, some of the safety measures or safety elements can be monitored continuously using the technology, such as the sensors, all those type of things. So for that, I would like to share a video. So by using the advancement, the technology advancements, it will help a lot in terms of daily work, day-to-day work in terms of safety management. So we can see that the use of technology such as drones can give further advantage to the organization. Okay. So the way forward. Okay. What will be the way forward in terms of OHS management in IR 4.0? Well, I can say that for the industries as well as for the players, the most important thing is to be ready and invest. We have to ready and we have to invest in two particular things. First is the knowledge and skills, and one more thing is the technology advancement. That's all for now.
Thank you, Ts Mohd Soffian, for the insightful presentation. All right. So just for information for the viewers, the link of survey can be found at the comment section. Please fill up for the quality improvement and also to you to receive the e-certificate. Okay. So while your presentation just now, there are a few questions coming out. We're going to Q&A session now. Okay, Ts Mohd Soffian?
Okay.
So the first question from Miss Alfarina Samad. What is your insight of OHS industry for 4.0 technologies and their application in fighting COVID-19 pandemic?
Okay.
This is the popular issue right now.
The current issue is the COVID-19. Yeah. First of all, Faiza, let me give me a chance to elaborate a little bit further, because you see that to share my concern in terms of this issue. First thing first, when we take a look 4 days back or 5 days back, the numbers of new cases reportedly every day, nearly simply for the 5 days, 6,000 a day.
Yes.
Okay, so simply 30,000 or simply 35,000 for these 5 days. Okay, it's a huge number of new COVID-19 cases, and not only that, we are afraid in terms of the possibility, or we call as active cases, where the infectivity is very high. So as simple as if let's say 30,000 infect to 5%, you can see that we can have another 150 numbers in a few days coming. Yeah. So that is one part. Second part is about when we talk about new cases. Every day we are talking about new clusters, and no doubt we can see that the number of new clusters, majority of it came from workplaces. Yeah. You can see in the first quarter of 2021, which is the January to April 2021, according to the data that we have, 60% to 70% of the new clusters are from the work side. Okay, now let's go through the question just now. So how IR 4.0 may help this? Okay, now for your information, when we look into this so-called technology advancement, actually, when we talk about technology advancements in terms of COVID-19 management, most of the developed industries has been used. In fact, not all not only the developed industries. We can say such as China, because they really invest in terms of AI, artificial intelligence. Okay, you can see how they implement the AI, the artificial intelligence, in terms of helping the government in managing the COVID-19, such as you can see their face recognition technology, their temperature screening, all those type of things has been used mass can consider as mass used in China, as well as their industries. And in fact, in Malaysia, we do have this kind of things as well for certain industries. I encounter myself I encounter in some of my clients' places where they already apply this kind of technologies in their workplace, such as the thermal scan, all those kind of things is in the sake of helping the management of COVID-19 at workplace. So basically, I can say that COVID is an unfortunate time for us, but AI is an fortunate. Consider as it is at the best time for us to invest, as well as to implement or take part in terms of IR 4.0, the revolutions of the industries.
Okay. Maybe we can have some technology that can capture whoever that have COVID-19 on, or after this, no need to just use some experiment, some test to go. Right?
Maybe in the future. Yeah, just to share with you the latest. I'm not sure whether when you know not about this, but for your information, in Thailand, they have trained several police. The dogs of police? The dogs to detect those who are COVID-19 positive. They use dogs only. And the accuracy is promising. I forget about how is the accuracy rate, but promising, which is more than 70% accuracy.
More than 70% is good enough, I think. All right, thank you for the first question. The second one is from Mr. Rajan Sundra. He said, like, currently we have more than 3 million foreign workers in Malaysia, especially in the construction industry. Often and not, we hear and read about serious workplace accident among them. Okay, what effective means of the accident prevention should be in place for these foreign workers, as their work knowledge, work habits, and work attitude towards safety and health is very low. So this is not about the IR later on, but it's current situation, what happened in Malaysia nowadays for the OHS, at the OHS in scope.
Okay, thank you, Mr. Rajan Sundra. For your information, in fact, when you have a look in terms of the national agenda in terms of IR 4.0 that has been developed by the MITI, you can see a very interesting statistics being shared in that particular document in terms of our dependency, towards foreign labor. Okay. No doubt, we need them in certain labor sectors, okay, such as the constructions, manufacturing, all these kind of things. So no doubt, okay. But when we talk about the accident prevention, I would like to remind, especially those safety practitioners first. When we talk about accident prevention, first thing first, we need to understand the responsibility of the employer with the by the advice, okay, or with the advice by the safety practitioners, is to ensure. First thing is to do the hazard identification, or to we can say as simple as to do the risk assessment. Okay, but how are we going to do the risk assessment is to identify the hazard first, then do the risk assessment, and at the end of the day, by identify the hazards, you can implement the right control towards that particular hazards. So let's go back to basic. First thing first is to identify the hazards. Why accident happens? Accident happens basically is due to two things. First is unsafe conditions. Second is unsafe act. Okay, without these two things, with the absence of these two things, normally accidents can be prevented. Okay, so now when we talk about risk control itself, okay, back to the highest control, okay, the highest hierarchy of control is prevention. Okay, so no doubt we have to understand. Sorry, the highest hierarchy is elimination, means we have to prevent. Okay, so no doubt. First thing first, go back to basic, identify the hazards, then we will have the opportunity to propose the best control, okay, for that.
And then for the elimination also we have the for the admin, because admin come with the training, right? So we can train the foreign worker with the how to look for hazard also, right? So next question from Mr. Rajan Sundra. This is about the in line with IR 4.0 on safety and health. What are the new change or challenge placed on workplace and worker?
Okay, basically, when we talk about IR 4.0, and if the industry really implement IR 4.0, I can see that, to be frank, when we said about technology advancement, okay, the first video I share with you, in one part of the world, I'm not sure where this video came from, and you can see how the workers has been forced to fit in to the machine. Okay, so maybe that is during the IR 2.0 or 3.0 or whatsoever it is. Okay, but with the latest technology advancement, in fact, the technology advancement will help us in dealing with safety and health. Why is that so? I can pretty sure say, because when we talk about technology advancement, when we talk about design, all those kind of things, technology will come from design. Okay, safety is not about something where we will only implement during the process.
Yes, I agree.
During the manufacturing stages of new things, no, but it should come from the design process. Okay, it should start as early as when you crack your head in terms of design. Okay, that is why we talk about, let's say we talk about safety in construction. Yeah, we are not talking about you just do whatever you wish to do. Sorry to say, the architecture, the whoever the designer just design as you wish, but at the end of the day will cause a lot of accident. Yeah, it should come from the design stage. Okay, so I can say that IR 4.0, if it is been done correctly in terms with the technology advancement, it should really help the safety and health implementation. In fact, are we ready? Are we really ready? If IR 4.0 is full force, means full swing in the future, are we ready to be jobless?
Everything automation, right?
Automation. Are we ready to be jobless? So that is another question that we have to look into it actually.
Yes, because I can see for the maybe for the next for the manufacturing or the automotive, for the whole line, maybe just 20% of people can work at the industry. So people will remove from that, right? Okay, next we go to the more question from Ms. Tengku Nilam Tengku Ibrahim. In your opinion, do we meaning government, culture, Malaysian up to challenge for IR in terms of OHS management?
Okay, good questions by Ms. Tengku Nilam. For your information, it has been actually it's been highlighted in the what I said about the national agenda, the industry forward, that one. Okay, it's been highlighted what are the government lack of, and as well as what is the challenges, as I shared to you the drivers just now. So for your information, are we up to the challenge? Yes, we can say that yes, we are up to the challenge with IR 4.0. Okay, in terms of culture, Okay. I don't want to talk about the culture. I don't want to really touch in terms of culture of IR 4.0. No, but when we talk about safety culture, we are not up to that yet. Okay. In short, I can say that the safety culture of Malaysian is still quite low, but that's the challenge, or that's the opportunity. It means that we have a huge opportunity to enhance our safety culture. Okay.
All right. So another one is from Miss Amira Aminuddin. Hi, Mr. Sofyan. In your opinion, as a student, especially from EHS, Environmental Health and Safety, and OHS program, when they join the workforce of the future, so later on lah, future IR 4.0, what are the things they can do to prepare themselves? This for our students.
Simple as I said, the essence is first is knowledge.
Knowledge, yeah, knowledge.
Okay. The most important thing is knowledge. Be ready. Okay. Now we're talking about this. As I said, the challenge, the current situations. We have to look into how, as OHS practitioners, how are we going to put ourselves relevant to the industries? When the industries change, the work style change, or the way of work, the way of doing things change. We have to be ready into it. Okay, and of course, when we talk about OHS management, for the OHS practitioners, yes, the fundamental knowledge of OHS is crucial, no doubt, but you have to enhance yourself with certain knowledge, such as the technology itself. Okay, because no doubt, if we didn't be with it, we will be left behind.
Yeah, correct. So everything about knowledge, knowledge, and knowledge. Okay.
Yes.
So next question is from Hazika Kamaluddin. May I know what is the first step employer need to focus? This is for the employer need to focus in OHS with the rapid change in the business and organization under IR 4.0. This is the second last question, and then after this, one more question we can take from the floor. Okay.
Okay. What is the first step? First step is to ready for the change. Ready for the change. I'm not sure, because when we talk about what will be the first step of overall, because different labor sector will have different approach. So first of all, as I said, ready for change lah. That's it. As simple as that.
But if you're not ready for change, you will leave behind. You will ketinggalan.
You will left behind. Right? It's just like when we talk about industrial revolutions. You can see, such as Nokia. Nokia is until now the statistic. The statistic of cell phone has been sold by brand. Nokia is still number one, even with the current technology, because of their what do you call it, very good in the past. Yeah,
in the past.
But they are left behind because they are not ready for change.
Nowadays, a lot of company like that. I can see.
Nowadays, if I ask how many of you use Nokia, you will like, what is that? Okay.
I think back my primary school last time.
It is during my matriculation time, when you use a Nokia, you are very.
So we have like Nokia Sabo and it's like that, right? So
yes.
That is your first cell phone for first cell phone lah. Okay, and then the last question from Flo is from Encik Azlan Abi Azra. Most of the private industry just stress the technology of IR 4.0 only for their business continuity and to less towards safety as they see that this can be burden to the organization. Okay. Any idea on how to make the big hand more aware on this? Thank you.
Okay, that is why my presentation at first I asked, do we really believe that safety is everyone's business? So it is something for you to ponder. You can answer the questions according to your organization's culture. Do we have this kind of safety is everybody's business, or safety is safety officer business? So for this, I can say that the most important thing is we have two factors. One is pushing factor, one is pulling factor. So I believe that we need to enhance our pushing factor as well. So the most has been defined by the agenda as I shared to you. One of the most critical factor is the regulations. Okay, but I believe that the amendment of the OSHA 2020 that has been tabled in Parliament for the first reading in 2020 last year will help a lot in the implementation of the new era of OSHA in the industries. Yeah, I believe let's pray, let's hope that the COVID will settle down soon, and let's hope that the amendment will be tabled for the second time and been
new regulation come out.
Yeah, and the amendment will be passed. Will pass the Parliament session as well as the Dewan Negara, and we will have the new regulations in line.
Because 94 is back 30 years ago.
Yeah, 1994 is back 30 years ago. But no doubt, Faiza, just want to share with you that there's a lot of effort has been put in OSHA 1994. There's a lot of work has been done in order to ensure that the law is there. And in fact, I can say that OSHA 1994 is what's say it is a part of victory,
yes.
to the enforcement agency as well. You can see nowadays, days to days, we can see that the enforcement has been done. The increase of numbers, the increased numbers of enforcement has been done accordingly. Yeah.
Yeah. All right. Thank you so much, Cik Soffian. So that's all for the Q&A session. So we have to come to the end of today's session. Thank you again, Cik Soffian, for joining us today and providing such insightful information. To our wonderful audience, thank you for joining us at this webinar. We look forward to your comments and participation at future events hosted by MAHSA University. In case of any further queries, you can contact us through MAHSA website or visit our social media. Thank you so much, everyone.
Thank you for the opportunity. See you again.
Thank